Good morning. So it's 9:17, and we're all awake, we're all here, so I'm gonna say good morning one more time so that I can feel like I'm with the folks. Good morning. Thank you, thank you, thank you. So I really want to welcome you to this really exciting event that we have planned for today. This is the last of the REACH Collaborative Learning Table events, and this one technically focuses on our employment table, but obviously we are focusing a lot today on poverty. And when we think about social determinants of health, which I'll be talking about a little bit later, one of the things that we know is that there's little question that the elimination of poverty in this country would do so much to eliminate many of the challenges people face with regard to the social determinants of health. I'm not naive enough to believe that the elimination of poverty would solve all problems, but I absolutely believe that they would make a huge difference. And one of the things that I am hopeful about for this particular conference is that all of you will walk away as ambassadors willing to talk openly about the elimination of poverty in this country as an achievable goal. Because if we can't dream it, we can't make it happen. And then as I'm standing here, I realize I forgot to introduce myself. I just think everybody knows me, and of course you don't. My name is Denise Rodgers. My work title is Vice Chancellor for Interprofessional Programs at Rutgers Health. I'm a family physician by training, but most importantly, here today, I'm the Principal Investigator for the REACH initiative, which I have just been so privileged to work with a wonderful team of people in REACH, and I'm just thrilled that you all are here joining us to help us, hopefully, and already are helping us with this work. So we have a couple of special guests to offer some welcoming remarks. Of course, I would like to start by introducing the president of Rutgers, Jonathan Holloway. As any of you know who work here at Rutgers, Dr. Holloway has been an amazing champion of most of the things that we care deeply about. He's been a champion for the creation of beloved community, where we learn to care for each other, where we learn to dialogue across difference. He's also been a real champion for fostering student civic engagement, which I would offer at a time like this in our country could not be any more important, as we need everyone in this country to be engaged and thinking about the things that are going on. I am sad for us, but happy for him to report that Dr. Holloway will be ending his tenure as president of Rutgers in May of this year, but I am happy for him to report that he will become, has become, the new president of the Henry Luce Foundation, which sadly I think is not going to fund REACH, but hey, it's good for him anyway. So Dr. Holloway, welcome, and please join me.
Thank you and good morning. I got pitched on REACH already, but when I was waiting for the event to begin. Thank you to everyone here today, New Brunswick, Newark, and Camden. As I begin, let me affirm quite clearly, research universities like Rutgers are indispensable to the future of a strong and prosperous nation. American colleges and universities, public and private, form the finest system of higher education in the world, and our historic partnership with government has produced life-changing breakthroughs, technologies, inventions, and medical discoveries. I just wanted to say that as an affirming principle to remind people of what we do, what we have been, and what's at stake. I could not be more proud of our faculty, students, and staff and the research we do across the breadth of human endeavor to serve the common good, seeking solutions to our nation's and the world's most pressing challenges. And there are a few more vexing problems in the 21st century society than poverty and the health and other disparities that still exist here in our most prosperous state and nation. Despite all our wealth as a country, America has seen evictions and child homelessness increase, visits to food pantries increase, and the number of families dependent on food stamps increase since 2000. And Black pregnant patients in the US are 3 times more likely to die than white pregnant patients. These are horrific things to say. Tackling poverty and addressing the social determinants of health in our state is an all-hands-on-deck proposition. Not just the researchers or the providers or the community leaders or the residents themselves, but everyone working together. We all need to feed our expertise and energy into the solution, and the effort must be deliberate, sustained, and thoughtful. You know this better than I do. The good people who have come together with REACH have my immense admiration for the work that they have done in clear and close partnership with one another to begin the huge task of closing the gap in health outcomes in our state. As you might be aware, I had the honor to serve as a co-chair of Governor Murphy's Wealth Disparity Task Force. The final report pointed out that family wealth is cumulative, and so too are the disparities that compound themselves when a family does not have access to the opportunities that they need to break out of poverty. Among many other findings, the report noted, wealth disparities for students begin outside of the classroom. They enter hungry, tired, lacking warm clothes in winter, afraid, and even traumatized. The list of 30 proposals that we put forward were both specific, such as eliminating the fees on phone calls between those in prison and their families, and broader, such as advancing efforts to ensure food security. In my work on that task force, I saw ever more clearly how these factors were all interconnected. The chance to secure a safe home, breathe clean air, and attend an excellent school. The opportunity to earn a living wage, have access to a healthy diet, receive quality medical care, and give your children a better life. These are, of course, the basic needs that every parent and child in New Jersey deserves. I'm proud and grateful that through the REACH initiative, we have set a new vision for addressing health inequities. By embracing community-engaged scholarship, we have formed truly collaborative approaches that rely on the enormous expertise within our host communities. Together, side by side, working on everything from product design to grant making to policy development to data tracking, this is how we can move forward. And the data shows that we have. In 4 funding rounds totaling approximately $3.8 million over the past couple of years, REACH supported 34 unique projects focused on either education, employment, food access, housing, or population health that saw our faculty engage in 56 partnerships with 42 different organizations. And more than half of the funding awarded was then subcontracted or re-granted to community partners. Now, today's symposium, organized by REACH, promises a candid conversation around poverty and its influencing factors. We are so fortunate to have Matthew Desmond, author of the book Poverty by America, as our keynote speaker. He comes at the problem both as a scholar and as someone who experienced poverty himself as a child. He asks hard questions about who benefits from inequality and poverty in our nation, and whether the rest of us act consciously or unwittingly to keep it that way. We also have outstanding panels on critical issues related to poverty, food insecurity, economic mobility, health equity, housing instability, and more. We will discuss who is Alice, those who are asset-limited, income-constrained, and employed, and we will look toward collective actions that might be taken to address poverty in our state. I'm really so grateful that these conversations are taking place today. This symposium could not be more timely or more urgent. And I really want to thank you all again for taking part in the discussions on each of our campuses. As it happens, this symposium falls on a special day. By joint resolution of the legislature, April 9th has been declared Paul Robeson Day in the state of New Jersey. Robeson, this university's most accomplished alumnus, was not only a fantastic athlete, brilliant actor and orator, and world-famous singer, but also a tireless advocate and activist for racial equality and social justice. So let me close then with a quote from his autobiography, Here I Stand. "To be free," he wrote, "to walk the good American earth as equal citizens, to live without fear, to enjoy the fruits of our toil, to give our children every opportunity in life. That dream which we have held so long in our hearts is today the destiny that we hold in our hands." Thank you for all that you're doing together to give children across New Jersey every opportunity in life, and so build a more prosperous, more equitable, and more just state. It is, in fact, in your hands. Thank you.
Thank you, Dr. Holloway. Next, it is my pleasure to introduce Amber Randolph, who's the Associate Vice President for the New Jersey Department at the Robert Wood Johnson Foundation. And let's be clear, no Robert Wood Johnson Foundation funding, no REACH. So clearly, we are enormously indebted to the foundation, to Amber Randolph. And of course, I always have to call out my colleague, Marco Navarro, with whom I've worked probably for over 20 years, who does a lot of the community-based work at the Robert Wood Johnson Foundation as well. So thank you to you both. I will say before Amber comes up that there seems to be a little trend here, because Amber was one of the major administrators at Rutgers Newark and now moved to the foundation world as well. So, you know, who knows, maybe my next job, what can I tell you? But it's my pleasure, Amber, to welcome you to give a few remarks.
Thank you so much, Dr. Rodgers. Philanthropy could certainly use someone like you, but no, I think you're doing great work here. I'm thrilled to be with you all today. As Dr. Rodgers said, I'm Amber Randolph. I'm the Assistant Vice President of the New Jersey Department at the Robert Wood Johnson Foundation, and it is just an honor to be here with all of you today as we gather for what I hope will be candid conversations about our health in our state, our great state of New Jersey, and the powerful efforts that are taking place to improve outcomes for our state's residents. At the heart of today's event is something we all know to be true. Our health is shaped by so much more than what happens inside of a doctor's office. It's shaped by access to affordable, stable, safe housing of our choice, the availability of nearby grocery stores and the accessibility of healthy food, the education that we receive, the income that we earn, and the ability to receive equitable medical care that doesn't require sacrificing other essential needs to receive them. And yet too often, certain communities throughout our state face systemic barriers that put health opportunity far too out of reach. And that's why what we're going to learn here today and talk about matters so much. REACH and the Rutgers University-wide efforts to address health inequity are essential in identifying new approaches to bringing long-lasting and systemic change. By leveraging the experiences, the expertise, and the knowledge of the esteemed Rutgers faculty, the incredibly talented Rutgers students, and the powerful community leaders and organizations, REACH is helping to advance solutions that shape healthier and more equitable communities. And we think will be a real model for the rest of the state and hopefully the rest of the country. These projects span across all three Rutgers campuses, 3 of the 4, I would say, Newark, Camden, and New Brunswick, and are deeply grounded in, as Dr. Rodgers said, the social determinants of health. Whether it's understanding and strengthening pathways to high school graduation in the city of Newark, catalyzing resource development and capacity within food systems right here in New Brunswick, or facilitating equitable home mortgage lending opportunities in Camden. And there are over 31 more examples of projects funded by REACH that are helping to transform our communities in really powerful ways. These are models for change that we believe are scalable, rooted in community power and community input, and designed for long-term and sustained impact. And that's exactly what we need right now. We know that when we knock down the barriers, the systemic barriers that have been put in front of so many, and focus our efforts on eradicating poverty and the systemic racism that perpetuates it, we will have a clearer path towards prosperity for all in our home state. This work allows us to build new models of care, new pathways of access, new conversations, new relationships to be built, and new opportunities to build and improve health outcomes where the need is the greatest, most acute. At the RWJF, we are committed to working toward the promise of a healthier, more equitable New Jersey by addressing health disparities from the generations of racial injustices. Work that we acknowledge may be more challenging to pursue in this very moment, but more important than ever. And we're so proud to stand alongside and support REACH and Dr. Rodgers and the entire team, and so many of you in this room today who are doing the essential work of driving meaningful, powerful change. I'm looking forward to the panel discussions. I'm looking forward to connecting with many of you, the presentations and important conversations that we'll have today. Thank you again for having me.
Thank you so much, Amber. So I'm going to give a few remarks about REACH, but before I do, I need to do some housekeeping or Diane Hagerman, the executive director, will shoot me. So let me be clear. We failed to put the room numbers in the agenda. So on your tables, you will find an agenda that has the room numbers for the various sessions. We also, though, have, if you scan the QR code on the table, you will get the agenda, but you have to look at the piece of paper in order to get the room number of where you want to go. So just taking care of that. The other thing I failed to do when I first came up here was to give a shout out to the folks who are in Newark and Camden who are joining us remotely for some of our plenary sessions and some of our panel discussions, but there will be a series of activities that occur on those campuses as well, because REACH is a multi-centered initiative, and so we wanted to make sure that this event took place in all three of our major campuses, and so we are here. All right, so let me look at the times to make sure I don't run over too much. I'm just going to show a little bit of data about REACH, and I'm going to hope now that this slide works. Nope, I got to go back one. Okay, so just to review, REACH came about because we got a $10 million grant from the Robert Wood Johnson Foundation over 4 years. We are coming to the end of our funding, but one of our goals was to give 4 of that $10 million in grants to Rutgers faculty who were required to partner with community leaders and community-based organizations in order to be able to get the funding. Our focus was on 5 social determinants of health, as you've heard: education, employment, food access and security, housing, population health, and our focus was on Camden, New Brunswick, and Newark. And hopefully it's not hard to figure out that these are the 3 main cities where our campuses are located, so we thought, let's do some work in our own backyard. So I want to ground this presentation and the day's work in some data about poverty in New Jersey. And what you see here is that African Americans and Latino communities have been disproportionately poor since 2010. I would argue they probably be disproportionately poor for the last 50+ years, if not more. But here we see the disparity in poverty rates, and we see, quite frankly, our lack of significant progress in reducing that disparity. What we also see, though, is that there are pockets of poverty in New Jersey. So if you live in Essex, Passaic, Hudson, and Cumberland County, far more people are likely to be poor than compared to some of the more affluent counties here in the state. What I also, though, want to pay particular attention to is the level of poverty among children under 5 years of age. Because one of the things that is remarkable to me is that we haven't figured out how to solve this problem, and that we tolerate this. We tolerate the fact that about 1 in 4 African American children under the age of 5 live in poverty, and about 1 in 5 Hispanic children live in poverty, compared to about 1 in 10 white children and about 1 in 12 Asian children. And quite frankly, 1 in 12 Asian children is too many. But if we look at the counties where there's poverty in children, we see two things. One, it's a little bit more widespread around the state. But the other thing we notice, which you probably didn't pay that much attention to, is the scale changed. And the scale changed because there are so much higher levels of poverty in children under the age of 5. And so one of the things I wanted to do was to translate the data into people, because it's so easy for us to talk percentages, right? So it's so easy for us to talk about the fact that whites make up 52% of the population of New Jersey, 6.6% of whites live in poverty, but that represents 318,862 people. And one of the things we see here is that there are actually more poor white people in New Jersey than there are poor black people in New Jersey, because so often we tend to want to make this seem like it's just the problem of black and brown communities. It is a problem for us all. And I also want to point out that nearly 72,000 children under the age of 5 live in poverty in our state. So the social determinants of health clearly are impacted by poverty, right? And they're the circumstances in which people are born, grow up, live, work, and age, as well as the systems put in place to deal with illness. These circumstances are in turn shaped by a wider set of forces, economics, social policies. And I gotta say, I was so tempted last night to make the whole slide the word politics. But clearly we are seeing that reality in terms of the impact on social determinants of health. So I want to give you a sense. Look at this graph. Look at the impact on the odds of death just by graduating from high school. You significantly decrease your odds of death just by graduating from high school. And then obviously the more education you get, the more your odds of death decrease, although nobody's odds of death decrease to 0. I hate to break it to you. We're all gonna go at some point. But what it also means is the importance for all of us when we interact with young people to reinforce to them the importance of education. If we look at the impact of wealth on life expectancy, the bottom 10% by income of people in this country, on average, live close to 14 years less than the top 10%. This poverty directly impacts health outcomes. Robert Johnson Foundation tells us that health equity means that everyone has a fair and just opportunity to be as healthy as possible. And one of the things that we know is in order to make that the case, we have to deal with social determinants of health. I always put up this definition of health disparity because I want to emphasize that health disparities are preventable. There is nothing inherent in people that contributes to health disparities. These are preventable things that are largely related to social determinants. So how does this play out in New Jersey? What we see is that African Americans have the lowest life expectancy at birth compared to all other groups in the state. What we also see is that this life expectancy disparity has gone on for the last 20 years. I would argue it's gone on for the last 100 years, if you pay attention in this next set of slides to the yellow line, because that represents African Americans. And so what we see is that African Americans have substantially lower life expectancy than all other groups in the state. What we also see is that African Americans have significantly higher age-adjusted death rates. And the spike we see, as you would imagine, in part is related to COVID. But what I also remind people is that spike is also related to drug overdose, which we don't talk about enough either, quite frankly. All of you, I suspect, are aware of the fact that a black infant born in the state of New Jersey is 2.5 to 3 times more likely to die in the first year of life when compared to their white counterpart. And as we see, of course, this has been a historical trend as well. I was speaking to someone earlier this morning, about the fact that when I came here in 1997, one of the first things I did was to become part of a black infant mortality task force that was started by the Department of Health. We have made some progress in these past 26 years. We have not made enough progress in these past 26 years. So at REACH, which is the Rutgers Equity Alliance for Community Health, by the way, this is what we focus on. These are our 5 social determinants. But our work is grounded in principles of integrity, collaboration, innovation, and of course, social justice. And as Amber reminded us, we can't talk about social justice without also talking about the challenge of racism that exists in our state, in our country, in our world. So we believe that by bringing together the enormous expertise that exists at Rutgers with our academic partners, with the experience and knowledge and wisdom of people who've been doing the work on the ground in the communities, we believed, and I hope we are going to continue to demonstrate, that we can come up with better outcomes because of the kinds of projects that we have helped to innovate. But I want to end by reminding all of us that we do this in the context of a Rutgers that is continually moving toward more community engagement. And I would argue that has been catalyzed by the beliefs and work and leadership of Dr. Holloway. And so much of this has to do with his leadership and support. And on that note, I will end. You get a little bit of chance to get some more coffee or tea. And then remember, look on the table on the piece of paper to find the rooms where you want to go. So thank you very much.